Hello, everyone, and welcome to Let's Make a Health Connection, your local Health Connect podcast series in Vancouver, Washington. In this series, we interview and showcase the many healthcare providers and resources that are featured on our website, localhealthconnect.com. For those who don't know us yet, Local Health Connect is a hub where our community can easily search local resources and connect with providers for mind, body, and spirit health. Thanks for listening today. I'm Jennifer Barber, licensed clinical social worker in Washington and Oregon, and I'm happy to be part of our community of providers. Today we're talking to Dr. Cynthia McNally. She is a board-certified OBGYN and owner of Evergreen Women's Health right here in downtown Vancouver. Hi, Cynthia.
Hi, Jen. How are you?
I'm doing great. How are you doing?
I'm doing well. Thank you.
Excellent. We are just wanting to get to know you, let the community know who you are, what you got going on here in downtown. And I'm hoping that you can start, let's just open this up. What made you start your own clinic?
Well, so I've been an OBGYN for 25 years, and most of that time I was doing the regular OBGYN thing, delivering babies part of the time and doing women's health the other part of the time. And then in 2014, I stopped delivering babies, and most of the time was in Vancouver, also before that in the Air Force. I started working in Portland and just focused on women's health care, so no more obstetrics, just gynecology. And I realized that there really was a need for providers that just focused on gynecology. And also, I didn't miss delivering babies. I didn't miss the hours or the stress. So I was trying to decide if I wanted to move to Portland or because I was still commuting from Vancouver. And so I wanted to decide, should I move to Portland or should I find a similar position in Vancouver, because the commute was just getting really overwhelming and exhausting. And I decided that I really love the Vancouver community and I wanted to stay here. And I could not find a clinic that just focused on women's health with kind of an emphasis on holistic care. So I decided I would start my own.
Mm-hmm. So do you just love Vancouver? I mean, what was the reason to start it in Vancouver?
Yeah, so I'm originally from the East Coast. I grew up in the Washington, D.C. suburbs, and the Air Force sent me all over the And when I moved to Vancouver almost 18 years ago, I really saw it as just kind of a suburb of Portland. And I always thought, if I ever end up working in Portland, I'll move to Portland. And then just over the years, Vancouver really grew on me, and I realized that it wasn't just a suburb, it wasn't just an offshoot of Portland, that it had its own entity. And then when that time came when I was working in Portland, and where it would have been advantageous for me to live there, I was like, wait a second, I actually like Vancouver more now.
Mm-hmm.
So I think it's more mellow, and it's not so set on being different from every other place, but it has its own vibe. I don't know if that makes sense.
Totally.
But anyway, I just it's a little bit slower than Portland. And I just also felt more part of this community once I had my daughter, who goes to Vancouver schools, and also I became more active in organizations in Vancouver, such as the Rotary Club. So I just felt more part of this community, and I decided I really liked it better than Portland.
Mm-hmm. Vancouver rocks, I must say.
It does. Well, it gets better every year is the cool thing. I mean,
It does.
Like, it's such a different place from when I moved here 18 years ago. It really is. It's become more sophisticated, more artsy. And I really love it here.
Mm-hmm. Our downtown Vancouver has changed so much in the last 20 years, maybe even in the last 10 years. It's just growing so quickly. So much is going in. And you are right downtown, aren't you?
Yes, I am. So that was a very conscious choice, because I still have a lot of patients that come from Portland, and I'd say probably close to half of my patients are from Oregon. And I think conceptually, when they look at a map and they see that I'm just right over the bridge, it's not as big a deal. Versus there are other nice areas in Vancouver, like East Vancouver or Salmon Creek, but they just look so much further away. So that was a big part of it. But also, I love how downtown has transformed, and I love that I'm in walking distance from cool shops and restaurants, and there's so many other entrepreneurs that are doing their own thing and making downtown more unique. So, yeah, so that was a conscious decision, and I am moving my clinic in 3 weeks to a larger location just a block away.
Mm-hmm.
Right now we're on Main Street, and we will be on Washington Street. And we're expanding from about 1,200 square feet to 2,000 square feet. And also right now we're sharing 1,200 square feet with a physical therapy group. And so we'll be having 2,000 square feet all to ourselves. And I've hired a nurse practitioner and a few other medical assistants. And so we're just really growing. But I definitely wanted to stay downtown.
That's wonderful. We're glad to have you downtown. So you said you did hire a nurse practitioner from the Oregon Clinic, and we're wondering
Mm-hmm.
what expertise will she add to the Evergreen Women's Health Clinic?
So she's been working a lot with the urogynecologists at Oregon Clinic. So she actually has more expertise than me in like fitting pessaries and doing testing for incontinence. She also has done a lot of extra training in sexual health, including pain with sex, libido, and she also has done extra training in vulvar disorders. So that would be chronic irritation, discharge. She just really complements my skills. I also have a lot of interest in vulvar issues,
Mm-hmm.
but as far as the sexual health, that's more her thing. And then what I have more expertise in that she does not is bioidentical hormones and menopause management and perimenopause. There are just so many other providers that are scared to deal with that. It kind of is more managed by naturopaths. So I feel like having a board certified gynecologist that can offer bioidentical hormones, but also knows about conventional hormone therapy is a real benefit. So that's my interest. And Natalie does not do a lot of that. She's interested in it, but that's how we complement each other. And then we both
Mm-hmm.
do just general gynecology, IUDs, pap smears, ovarian cysts. Well, surgeries I do, but she knows how to manage and refer. So yeah, I think we'll work well together.
What is Natalie's last name?
Her last name is Moeller, Natalie Moeller.
Great, great. So
Yes. And she
Cynthia,
will be
oh,
accepting new patients. Oh, sorry.
it's
She'll
okay.
be accepting new patients as of July 1st. But
Oh,
we're
good.
already scheduling for her. Yes.
Excellent, excellent. So, can you tell us how your clinic is different from most other OBGYN clinics?
Yeah, so the biggest difference is because I don't do obstetrics, I don't have to um, worry about getting called out for delivery. When I was with some larger groups, it was very often that a patient would have scheduled an annual with me a month before, and last minute, oh, sorry, Dr. McNally has a delivery.
Mm-hmm.
And so, and that was, obviously very frustrating for patients, but frustrating for me too. I didn't like that. And so one's always kind of torn, like, okay, do I go across the hospital now and sit with somebody who's laboring and, or should it was just always like a decision tree. So that's gone. I now can 100% focus on the patient in front of me. And I also have more time with patients because I'm not part of a large group. I don't have to answer to anybody else as far as seeing a certain number of patients a day or making certain revenue markers. Some of the very large clinics in town, it was very focused on how many patients you saw and how much money you brought in.
Mm-hmm.
And we don't have as much, the overhead that a larger clinic with the various managers and levels of bureaucracy have. So I'm able to see more patients see patients longer
Mm-hmm.
and not get distracted by other things like labor and delivery.
Yeah, I think a lot of people are out there hoping and wishing that when they finally do find a doctor, it's somebody who's going to take the time, right? Take the time to listen,
Yeah.
take the time to really dive in. And some docs don't have the time, and you've eliminated some things in order to make that time, which is awesome.
Yeah, and I think most doctors would like to have that time. I think uh, I hear a lot of frustration from my patients about being rushed through visits and being dissatisfied with their providers. But I think I know most of the doctors in this community, and they're good doctors, and I think they wish they had more autonomy and could spend
Mm-hmm.
more time with patients. So it's kind of the system that we are dealt with.
Yeah, absolutely. So I'm wondering, what are the biggest misconceptions and health myths that you encounter with your patients?
Oh yeah, so this is big. I spend a lot of time just educating women about the difference between a pap smear and a pelvic exam, and why things have changed so much. Um, so in 2012, up until 2012, women were getting a pap smear and a pelvic exam every year, beginning around age 18,
Mm-hmm.
and some of them were getting like two pap smears a year if there was anything slightly off on their pap. And then in 2012, there was this radical change, and it was based on science and research, and the understanding now that HPV causes cervical cancer. So in 2012, they said, okay, we don't need to do a pap smear in somebody under the age of 21. If a pap smear is normal between ages 21 and 29, you can do it every 3 years. You don't need to do it every year.
Mm.
Beginning at age 30, we add HPV testing, which makes it an even more accurate test. And if your PAP and your HPV are both normal or negative, you can go 5 years without a PAP. So that's like a huge jump. And a lot of us are not 100% comfortable with, waiting 5 years between PAPs. But the PAP is just screening for cervical cancer. So it's not the rest of the pelvic exam. It's not feeling the ovaries. It's not looking at the vulva. It's not taking the menstrual history. It's just simply that screening test for cervical cancer. So there's a consensus on how often women need pap smears, because cervical cancer is caused by HPV virus, and that's very slow growing. So that's every 3 to 5 years. But what there's not a consensus on is how often a woman needs a pelvic exam, which is everything else. And it gets really confusing for women because they're hearing, oh, you don't need an exam for 5 years. And then other doctors are saying, oh, no, we may not do a PAP every year, but we're still going to do a pelvic exam every year. So it's just so confusing for women. But I think the first thing is knowing the difference between a pap smear and a pelvic exam. And once you understand that it's just screening for cervical cancer, it's not screening for anything else, then you understand that a pelvic exam should not be only every 5 years. It should be more frequent. If for no other reason, just to take a history and just to check in. There's a OBGYN who does a very popular blog, and she uses the term check-in instead of check-up. And
Mm.
I think that's a really good way of seeing it, because you're checking in and talking about your menstrual history. You're talking about your sexuality. You're talking about symptoms. Is this normal? Is this not normal? Should I be worried? You're talking about your family history. Okay, my aunt had breast cancer. Now, should I get a mammogram earlier? So much of the importance of the visit is not just the exam. It's the checking in part.
And that bit kind of leads me to this other thought. Seeing an OBGYN for a lot of people is extremely vulnerable. It's a vulnerable thing
Mhm.
to come to a clinic. And I think about our members of the community who may have had some sexual trauma, and
Right.
they know, oh man, it's been such a long time since I've seen my gynecologist, or maybe have never seen one, and they're
Yeah.
afraid, right? They're afraid to come in and have
Right.
that conversation. And I'm wondering, if someone were to come in for their first appointment with you and they had a
Mhm.
history of trauma, sexual
Yeah.
trauma, how could you
Right.
help them begin to have that conversation, or put them at ease so that they could have an exam and feel safe?
That's a very good question, and it basically addresses trauma informed care. And so, for one thing, I see many women who have a history of trauma who haven't had a pelvic exam ever or haven't had one in 10 years.
Mm-hmm.
And the first thing is they're embarrassed about it. Not only they're embarrassed about the trauma, but they're embarrassed that they haven't been seen. And they feel like they'll be judged for that. And so I always, tell them that, no, I have plenty of patients who haven't been seen in 10 years, which is true.
Mm-hmm.
And it's great that you're here now. I mean, it's great that they showed up. And then the other thing is we never force anything. I will recommend a pelvic exam, but if somebody is uncomfortable with that, then no problem. We don't have to do that today. We can wait till you're ready. And then addressing the trauma, asking about do they have pain with sex? Are they able to use a tampon? And when the answer is yes to pain or no, they can't use a tampon, then very often before I even do any kind of exam, I will refer them to a pelvic floor specialist. So a physical therapist who specializes in pelvic floor disorders, and many of them also specialize in trauma. And they will work with a patient, getting them comfortable with a pelvic exam. And often that involves biofeedback. It involves vaginal dilators. Sometimes I'll order a suppository to help relax those vaginal muscles. So it's just a step-by-step process. But the main thing is, number one, that they're not embarrassed by not being seen for so long. And then number two, just taking it gradually, no rush. We don't need to be doing a pelvic exam the first time that they see me. But then addressing the pelvic pain and the tension, the pelvic tension, and knowing that there are ways to treat that is really important.
Mm-hmm. Mm-hmm. Thank you so much for explaining that. I think that could potentially put a lot of people at ease to just make that first call and come on in.
Yeah.
I
And
have.
Natalie Moeller also, she is definitely trauma informed, definitely very good with women who've experienced trauma.
Mm-hmm. Okay, great. I have a question for you that I think maybe you're not quite expecting, but I'm going to add it in here.
Okay.
Uh,
Okay.
I'm wondering if you have experience working with the trans community. And if you have experience with people who are transitioning or have transitioned from female to male, and yet they are still needing to come in to have their
hmm
checkups, what's your experience? And can you tell us a little bit
Um,
about that?
yeah, so I do have some experience, and I'm kind of learning as I go. And actually, I learn a lot from my trans patients. Um, I ask questions. When I was working in Portland, I became acquainted with that community more. And I remember I had a very friendly trans male who saw me for menstrual issues. He still had a uterus and was having some bleeding problems, and he had a full beard, had stopped testosterone years before, and I was really confused. I mean, this is nothing. I graduated from medical school in 1995, and this is not anything that we learned about.
Mm-hmm.
And it's getting better. The OBGYN community, definitely, there's a lot more continuing medical education about it. There's a lot more practice bulletins recommending, how we treat that community. But in any case, so for this particular patient, I just started asking questions like, okay, well, how do you still have a full beard if you stop testosterone injections? And he explained, well, once you get that process going, the follicles, then it's on autopilot. You don't need to have the testosterone anymore, that kind of thing. So
Mm-hmm.
it was great because he was like, ask me anything, and so that was kind of the beginning of my education. And then since then, if a patient is receptive, I'll ask them, questions maybe if I'm not clear on it, because I haven't had any formal training. So to answer your question, I haven't had any formal training. All of it has been kind of as I go on with the experience of treating these patients, just learning as I go.
Mm-hmm.
But
Okay.
I am interested. I mean, they definitely are. They definitely need good care, often gynecologic care, and I think especially in a more traditional community like Vancouver, they can be more hesitant to seek
Mm-hmm.
that care. In Portland, where there's a larger trans community, I think they feel more comfortable. And then also there are some clinics that specialize in trans health. I think Legacy has a good clinic in Portland.
Mm-hmm.
And so
Mm-hmm.
there definitely are some things that I don't know, and I'm just going to tell, like I've had a few phone calls whether I could deal with this issue or that issue regarding testosterone. Like I don't have experience, and so we'll refer them to the clinic in Portland.
Mm-hmm. Yeah. Okay. Good. Good to know. All right. Is there anything else that you would like our community to know about you, your clinic, or your new practitioner that's coming in?
Let's see. I think I've said a lot. I feel like I've
Mm-hmm.
talked a lot.
Yeah.
Um,
Appreciate it.
no, just we are still accepting new patients right now. While we've been building out the clinic, and that's been a lot of work. And we're going to be moving in a few weeks, and we're closing our clinic for a few days. So right now, if a new patient calls, they'll be told that I can see them in July. But that's going to change a lot once Natalie joins. We're going to have a lot more accessibility. We also, beginning in September, will have 2 Saturdays a month that we're open, half days. I was doing that before COVID hit. I was opened 1 Saturday a month for women who are really busy with work and just need to have that option. And then we decided we wouldn't do it right away, also because of summer. But in September we will have that again. So I did want to mention that.
Great. Absolutely. Okay. Dr. Cynthia McNally, thank you so much for joining us today. And people can find you right downtown. Can you give us your new address again?
Yes, our new address will be 1207 Washington Street, and we're basically in the same building as Amaro's Table, but just facing Washington Street instead of Main Street. We're across from this beautiful church, and there is street parking. We don't have designated parking, unfortunately, but there's almost always street parking available.
Wonderful. Okay, and then we will add this to the show notes, but can you tell everybody what the website address is?
Yes, it is www.evergreengyn.com, the GYN as in short for gynecology. Our previous name was Evergreen Integrative Gynecology PC, and we changed that to Evergreen Women's Health. But the website still is Evergreen GYN.
Excellent. And we'll put that in the show notes so people can find that too. All right. Thank you so much for your time today.
Thank you. I really appreciate it.
Bye-bye. Thank you again for listening to Let's Make a Health Connection. Find us on the interwebs at localhealthconnect.com. Also search for us on Facebook, Instagram, and Twitter. Links and show notes for this interview are available on our podcast page. I really enjoy putting these interviews together, and I hope you made a health connection. We'll talk again next time.
Let's Make a Health Connection, copyright 2021, all rights reserved, is the exclusive property of MBS Therapy LLC, a Washington-based company. Local Health Connect is inclusive and does not endorse any political or religious group. Thank you again for listening, and we'll see you next time on localhealthconnect.com.